Hi, welcome to the Central Venous Line Dressing Change Demo MPC. And the first step is to verify the order, and this would be in the policies and procedures because I need to change it ever so many days, so that's where I would find that. Need to gather my equipment. I need a Central Line dressing change kit. I need one thing of sterile gloves. Need some alcohol and tape that I just always bring just in case. Okay, and then I would wash my hands before I would leave and head to the room. All right, let's go see Mr. Pooh. Gel. Hi, Mr. Pooh. How you doing today? Good. Let me just check that you're you. Winnie the Pooh, 1929-569. Winnie the Pooh, 1929-569. Okay. All righty. Gel in. Okay, so what I'm going to do today is I'm going to change the dressing. And I'll just grab some more hand gel on my magic wall there, since I've touched a trash can. All right, Mr. Pooh, and okay, so let's just take a look here. Okay, everything looks good with your central line. And have you had the change done before? Okay, so this is your second change, so you know what we're going to do. Any questions? Nope, perfect. Okay, so I am going to elevate the head of your bed. I can get the rail to go up. There we go. Alrighty, so a couple things I'm going to need you to do is while I'm changing this, I need you to keep your head turned away from me when I let you know. So just face the other patient over there and keep your head turned that way as long as I'm doing the procedure. Can you turn your head? Okay, because if you can't, we can put a mask on you, but it's more comfortable if you just turn your head away. Since you can, we'll go with that. Okay, I'm just going to loosen a piece of the tape here in the corner of this dressing, so once I have gloves on, I can get it off without having to totally claw you. Okay, there we go. Okay, so let's get the stuff in our kit out. All right, 7/2014 is the expiration date, and this kit is intact, so we're good to use it. Okay. So I'm going to put a mask on so that I don't breathe on you while I'm changing this dressing. Alright, I'm just going to put this little thing there in case I need it. The fallacy of the one-size-fits-all glove, but you want to use them if at all possible because you know you'd like a raise this year, so waste not, want not. Okay. That's good enough for what I'm going to do with these gloves. Okay, so what I'm going to do is take this dressing off. So go ahead and turn your head away from me and keep it there until I tell you to turn it back, Mr. Pooh. Okay. And I'm just going to take a look at the site, and I don't see any redness or swelling. Is that bothering you at all? Is it sore? Nope. Okay, good. Okay, so I'm going to put my second pair of sterile gloves on. And these expire 9 of 2013. So we're good for a month. And the package is intact. And the whole time I'm keeping an eye on my sterile kit there and not working over it to keep it sterile. Perfect. All right, so now we're ready to clean. So we're going to pop this. Okay, Mr. Pooh, I need to scrub your site here for 1 full minute. Make sure we get it nice and clean. Site itself, under the tubing, top of the catheter, everywhere your dressing's going to be. Almost done. Okay. Now we just need to wait for that to dry. Takes about a minute. So I will sit here not contaminating my sterile gloves. So I noticed you were watching the fishing channel earlier. Do you like to fish, Mr. Pooh? Yeah? Ocean fishing or lake fishing? Oh, both. Yeah. You know, I used to fish, but I don't really like to touch fish. Not when they're not dead anyway. Squiggly little things kind of creep me out. I like going on the boat part, though, if you don't make me catch any fish. Your daughter likes to fish? Well, that's fun. So did you spend a lot of time with her when you were a kid, when she was a kid fishing? Cool. It's a good country western song about that. Of course, there's a good country western song about just anything like that. Enough to make you cry. Okay. Got a few more minutes here. have any questions about your IV? Can stay in for at least a year, so as long as you don't get any problems, it can stay in there for a year. And if you change the dressing, have the nurse change the dressing, and you leave it alone in between dressing changes, you should be fine. Usually only gets infected if the dressing comes loose and they don't kind of call the nurse and get the dressing reapplied. You just really want to make sure it's always got a good occlusive dressing on it, because that's what'll keep you safe. Okay, so that looks pretty dry, so we will go ahead and get the dressing on, the new dressing on. Center this right there. Your skin was still a little wet. Didn't get a nice corner, but the part that needs to be covered is. Okay. So we're just gonna put a little piece of tape over the edge there. Secure. Take this piece of tape off. Just move that a little bit. Okay, and then we want to label this. 8/5/13 and my initials. That on the other edge there. Okay, you can turn your head back, and you are all set, Mr. Pooh. We'll just clean this mess up. So you'll have that changed again in 1 more week. All right, let's do some charting. Let me just chart this Mr. Pooh, and then I'll be out of your way. Okay, so this is a central line in his right subclavian. So right subclavian, RSC. Has 1 lumen. The appearance is no signs and symptoms of IV complications observed. And that is at 12:55 and my initials. And site care 12:55. Central line dressing change per policy and procedure, and then my initials, and I've already signed them all, and we are done.